good to go.
All right, thank you, Alan. Welcome, everyone. I am Senator John Morgan from State Senate District 23. Today, we will be holding a regular meeting of the committee to study the safety of residents and employees in long-term care facilities. Before we get started, I'll read through a checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As chair of the committee to study the safety of residents and employees in long-term care facilities, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04 and its extensions, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was also authorized pursuant to the governor's emergency order. In accordance with the emergency order, I am confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the committee and selected legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch and/or listen to the meeting on Zoom or YouTube, and via phone by following the directions and links provided on the General Court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please email remote-senate, all one word, at leg.state.nh.us or call 603-271-3043. In the event the public is unable to access the meeting, it will be adjourned and rescheduled. Please note that all votes taken during this meeting shall be done by roll call vote. Finally, let's start the meeting by taking a roll call attendance. When each member states their presence, please also state where they are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will call the roll. Senator Ward.
I'm here and started, and I'm alone in the room.
Representative Stringham.
Yes, I'm here. I'm in Lincoln, and I'm alone in the room.
Representative Birch.
I'm here in Westmoreland and alone in the room.
And Representative McMahon.
I'm here in Windham, and I am alone in the room.
Thank you, Representative. And I am Senator John Morgan. I am here in Exeter, New Hampshire, and I have various family members going back and forth to the refrigerator to get snacks during virtual school time. All right, well, with that, everyone, thank you all very much for being here. We have, so that's the wrong one. The first order of business is future meeting dates. Today, we know that we do have Thursday, October 8th at 10 a.m. already scheduled. And Alan, Cam, we decided on the 15th. Is the 15th at 8 a.m. or 8 a.m. So the next meeting of this committee will be held on Thursday, October 15th at 8 a.m. And prior to adjournment, we can discuss a little bit about who we anticipate or who we will be inviting to that meeting, and any input from the public, of course, is welcome if they have additional input once we get to the public comment period. I will note that the report for this committee is due November 1st. So we're on track to provide a substantive report as a result of the great testimony that we've received from numerous stakeholders thus far. However, the time crunch has it so that we will only be able to have testimony from a very small group of people for the rest of the meetings that we do have scheduled. So October 15th at 8 a.m. will be the next scheduled meeting after the 8th. And then unfortunately we had Unfortunately, we had our testimony from Sue Misiorski from the New England Regional Director of Operations for Sage Life, unable to join us this morning.
Oh, okay.
But hopefully we have Mr. Craig Labor, the administrator of the Grafton County Nursing Home, with us.
We do,
Great. Can we bring him in?
sure.
Hi, Mr. Labor. How are you?
Good, good. Good morning,
Good morning.
Senator.
Thank you so much for joining us, sir. And we're very much looking forward to your testimony for regarding the long-term care commission to study the safety of residents and employees in long-term care facilities relative to cost controls in long-term care and relative to the reimbursement costs of training and nursing assistants, as well as anything that relates to the COVID pandemic. Sir, the floor is yours.
Okay, well, thank you very much for the opportunity to present before the committee. I just want to start by saying that the presentation will be from the perspective of Grafton County Nursing Home on how COVID-19 has impacted our nursing home, but I would suggest that it should also be viewed as being a shared experience by all nursing homes in the state of New Hampshire.
Mr. Labor, would you like the ability to share your screen, or is doing this verbally okay?
Verbally is fine.
Okay.
So I think beginning specifically talking about the resident impact that we've seen, I think in general it's fair to say that this experience since March has been wearing on our residents. In the beginning, everyone was unsure of what all of this meant, and there was a considerable amount of fear. And when we closed our nursing home to outside visitors on March 12th, this fear has remained in place for the last 6+ months. And I just recall most recently an example. On September 3rd, we had a staff member test positive through the Sentinel surveillance testing program that the state of New Hampshire has in place. And it resulted in 2 weeks of facility-wide testing with the National Guard. And, you know, again, the fear, you could tell, was certainly present, and specifically from the residents. One resident was very in need of consolation, you know, specifically saying that, you know, I don't want to be the cause of everyone getting sick. So it's a very trying experience that we're all going through right now. And our residents, unfortunately, are living this every day. The easing of restrictions has been welcomed. You know, as the summer has come along and the easing of restrictions have come into place, the outdoor visitation program that we were able to begin in June was incredibly important, and the emotional impact was evident right from the start. Having been personally been present for the first few visits of family members coming in to visit in our courtyard in the back of our nursing home, the tears that were immediately shed by residents who were non-communicative, but just the visual of seeing their loved ones was really moving. And also the tears of family members and tears of staff to see that. It was just very, very moving and so impactful. And this visitation program has continued. It's continued also indoors with transitioning to indoor visitation, and we did that in the month of August. And so it's been you know, a great opportunity, I think, to reestablish some form of connection between residents and their loved ones. We've also been able to resume portions of, you know, somewhat what we would call daily life here in the nursing home, and specifically looking at our activities programming and being able to have small group activities. We've been able to take advantage of the nice weather that we've had throughout the past, throughout this summer. And so having group activities outside, the resumption of hair care services was certainly significant. We had going, several months without some residents without being able to receive any sort of formal hair care service. So the first time that they were able to with our beautician was quite important and a huge morale boost for the residents and also for our staff too. It meant a lot for everybody. But despite our best efforts, I think it's obvious that there is a decline in our residents because their daily lives have been turned upside down through this pandemic. And no matter how much we try to do to, create some semblance of normalcy, if you will, it's not ever the same because we are still in the process of walking around our nursing home with surgical masks on. We're maintaining social distancing, where we are, still not able to have full group, large group activities and communal dining like we normally would. So their life is still being impacted on a daily basis. On the family side of things, I think it goes without saying that there was a tremendous amount of concern in the beginning for their loved one's safety. We did our best from a commitment to be as transparent as possible right from the start of keeping family members updated of what was going on here in the nursing home. We created email lists, phone trees. We were putting updates on our county website, on the county Facebook page, just to keep people updated about what was going on here, here in the nursing home. And that has continued. We also began virtual visits immediately utilizing FaceTime and the Facebook Messenger app, as well as Skype for family members to be able to visit with residents. I think the family members appreciated that certainly because of the visual that they were able to see with their residents their loved ones in the beginning. But the residents themselves, I think, found it very hard and in some instances difficult to comprehend exactly, what was going on. Talking to their son or daughter, husband or wife on a video screen and not understanding why they couldn't see them. So that was difficult for our staff to try to communicate the reasoning behind all of that. Families themselves, I think, have certainly appreciated the outdoor visitation program as well as the indoor visitation program, which we have in place. I think the one thing that should, from a family impact standpoint, should be highlighted here is family members that visited regularly, on a historic basis of visiting maybe 2 or 3 times a week, sometimes more, sometimes daily. They not only experienced a sense of loss in seeing their loved one, but I think we've seen that they've also experienced a sense of loss of not being able to see our staff. They're the caregivers that provide care to their loved ones on a daily basis. And so, when we have visits, whether they take place indoors or outdoors, these visits are, obviously it's important to see their loved one, but it's also an opportunity for them to have some normalcy in their lives with interacting with our staff. And so a lot of times the staff participate in these visits as well. So it's really, it's become very evident just how important our staff are, not only to the sense of comfort that that families have in knowing that their loved one is receiving good care, but also just in the sense of the role that they play in family members' lives, and in having them be part of their family as well. I also think that it's important to highlight that it's really evident that the sense of touch is very important, and specifically, when we have our visitation program, we have to maintain social distancing, and we can't allow hugs or hand holding or anything along those lines. And it's very difficult, I think, to see family members' reactions when their loved one, as a visit is ending, ask, can you give me a hug, or give me a hug before you leave? And a family member having to say, well, mom or dad, I can't do that right now. I'm sorry, because of the virus. And you can just see the pain on their face, because all they want to do is just, give their loved one a hug. And it's unfortunate that we can't quite accommodate that at this point. From a staffing standpoint, the impact has certainly been significant. In April, we had a positive staff member and subsequently a positive resident. And immediately when that happened, I think our nursing home was kind of branded with a scarlet letter, if you will. Our staff that work here in the community, they were kind of treated, differently in a way, if you will. You work at Grafton County Nursing Home, now you have COVID from that standpoint. And it resulted in our staff, in some instances, losing childcare because of that. I've heard stories of other nursing homes who staff have lost, apartments and housing because of that, working in a facility that has a positive case in it. So I think fear certainly played a role there, and fear for our staff. It led to medical leaves immediately being asked for, as well as, in our case, 2 resignations. And unfortunately, that stress was there, and it has, subsided as you go through these ebbs and flows of having, concern areas pop up with concerning staff members or residents displaying symptoms of the virus. And, God forbid you have a positive case in your building, but stress continues each day, and it's due to the fear of the unknown, of exactly what you're going to be walking into each day you come to work. I do want to highlight the long-term care stabilization program. That was to say that it had a positive impact for our staff, and is a bit of an understatement. It was hugely important, and it helped us retain staff. As the program went on through the end of July, it helped us to be able to retain staff, and it gave staff, that sense of security financially. And it was really, it helped them to, kind of stay with us through that time period of the program being in place. From an operational impact, operationally speaking, with the nursing home, our census has decreased due to the virus. We've had to create a specific COVID unit to treat positive residents when we do have one. We've also had to create isolation and rule out areas of the nursing home so that residents who are displaying signs of the virus will be tested and then isolated from their peers until we find out what the results of those tests are. So pre-COVID, we were running a daily occupancy rate of about 94%. And since then, we are running at about 82% right now because of having to take these beds offline. And we have obviously experienced a revenue shortfall because of that. We've greatly appreciated the assistance that the federal government has given us in forms of the provider relief fund disbursements that have come through. And so considering those, it helped us end our fiscal year in June on a good note. And so far through the first 2 months, due to those payments, we're technically only short about $80,000 in lost revenue, but taking those payments out of the equation, that number is significantly higher. From an admissions standpoint, admissions are certainly slower and more challenging. And that's mainly in part due to the 2-week quarantine process that we have in place. And those are guidelines under the Centers for Disease Control. And what we see is the emotional toll that takes on an individual coming into, I think, Pre-COVID, certainly coming into a nursing home, being admitted into a nursing home is a difficult experience. And now having to go through that same experience, but being told you have to quarantine in a room by yourself for 2 weeks. And when staff come in to provide care for you, they're dressed in full droplet precautions, wearing gowns, masks, eye covering. It's certainly a scary experience. And I think that, when you look at what historically our revenue, or I'm sorry, our referral sources have been, whether it be through the community hospitals that we have in our area or family members providing care to loved ones at home, dementia care is the #1 referral reason for referral being made to our nursing home. And to be able to try to quarantine a dementia resident or somebody suffering from dementia is very, very difficult. And it creates a tremendous amount of stress on our staff in trying to make sure that we maintain that quarantine at all times. And so the referral process for us and admission process has greatly slowed down due to that. And it is creating a bit of a backlog in our hospitals. And I've heard that from other nursing home providers as well. Also, from a staffing standpoint, prior to COVID, we were impacted by the national nursing shortage, just like any other nursing home was. We're currently down 14 LNA FTEs, and that's predominantly on our evening and night shift. And we're currently down 12 nursing FTEs. That's adding in both RNs and licensed practical nurses. So comparatively speaking, I'd say we are better off than other nursing homes providers that I've spoken to. But our overtime costs and contract nursing costs continue to rise, and the worry about staff burnout, trying to cover the holes that we have in our schedule is there, and then continue again focusing on the stress that we're living under daily. That staff burnout is a real concern for us. Also, from a personal protective equipment standpoint, in the beginning of the pandemic, the PPE supplies, they disappeared very quickly. Our main supply vendors that we deal with, vendors such as Medline and McKesson, they quickly put us on allotments for supplies. And that allotment distribution was based on our order history with the vendor specifically. And those allotments remain in effect to this day. So we've had to, in certain instances, go out to the secondary market to purchase personal protective equipment. And those prices on the secondary market are substantially higher than what we would pay through our vendors. And also the quantity comes in a smaller case size. So one prime example of this is surgical masks. So pre-COVID, we were paying roughly 8 cents per mask. And now we've seen prices as high as $1.10 per mask. So it's added a considerable amount of expense for us. We are also very concerned at the moment of what we're seeing nationally with a shortage of medical supply gloves. We've had an order in place with one vendor, with our main glove vendor since May, and we have yet to have that order fulfilled. And any other sort of vendor that we're looking for that contacts us offering PPE supplies can't guarantee delivery, and they're requiring, if not 100% payment up front, 50% payment up front. And so you're really putting yourself out there when you put an order in and not knowing exactly when you're going to be receiving that product. So it's a very considerable amount of fear that we have from that standpoint about making sure that we have enough supply to keep our residents and staff safe. I also just very briefly want to just talk about the state assistance that the state of New Hampshire has given us during this time, and take a moment to thank DHHS Commissioner Shibinette and the department for their assistance thus far. I think they have been nothing but supportive and have taken a true partnership approach right from the start of working with nursing homes to help us through this pandemic. Personal protective equipment has been, on the flip side, working with the state has been a great source for us to help us kind of bolster our supply. They've helped us maintain an inventory to keep our residents safe, but again, they themselves are experiencing difficulty in sourcing medical gloves, and so they are able to distribute what they can, but they themselves are also having difficulty sourcing that product. From a testing standpoint, I think New Hampshire has been at the forefront with the implementation of the Sentinel surveillance testing program. It's helped nursing homes identify asymptomatic transmission of the virus and potentially stay ahead of outbreaks. And we've also recently received antigen testing equipment from the federal government. And the federal government had sent 2 antigen testing units to nursing homes throughout the country. One of the units, unfortunately, has a very low accuracy rate, or if you will, and so with an 84% accuracy rate, it requires, if for a negative result, it requires that that be followed up with a traditional nasal swab to confirm that it is actually negative. And as to my knowledge, many of the nursing homes in the state of New Hampshire received this, if you will, kind of lesser antigen testing unit. And so that adds a little bit of comfort in knowing that, you're 84% sure that a resident doesn't have COVID-19 or a staff member doesn't have COVID-19, but still knowing that you have to follow it up with a traditional nasal swab and then have that sent out and wait on average of 48 hours for the result still adds to the stress that we live each day. I'd like to just add a couple of requests of the committee as you do this important work that you're doing right now. I'd like to first advocate for the resumption of the long-term care stabilization program. As I said earlier, the program was immensely influential in our ability to keep staff through the spring and through July. And the staff really relied on those weekly stipend payments. And it was a big loss for them when that program ended on July 31st. So if it is within the purview of the committee to make a recommendation, I would certainly advocate for the resumption of that program, especially as we head into the fall and winter, which by all accounts is shaping up to be a very challenging time for many sectors of New Hampshire's economy, but without question, a very challenging time for nursing home providers. And I'd also like to request that this committee look into and potentially advocate for the state of New Hampshire to work with the community college system to reinstitute licensed practical nursing programs. The nursing shortage, as I mentioned, was present before COVID. It's still here during COVID, and it will be here after COVID. And what we as nursing home providers feel is important, I think, is to have the community college system be a partner in helping to train nurses, because that's our biggest need at this time. And so if the state of New Hampshire could work with the community college system to get these programs in place and perhaps offer tuition assistance, perhaps even a loan forgiveness program for a commitment to work in a long-term care setting for 2 or 3 years, I think we would be very supportive of that type of idea and very appreciative of this committee's ability to get something like that done. And so I just want to close by saying that nursing homes have certainly been the focus throughout the pandemic, and for good reason, considering the vulnerability of the residents that we care for. But I think that there's been a lot of discussion about quality of nursing homes and the tying of quality versus having COVID-19 in your building. And I think that a nursing home that experiences an outbreak doesn't mean it's a bad nursing home. And because this virus, in my opinion, doesn't differentiate between a 1 or 2 star facility versus a 5-star facility. This COVID-19 pandemic didn't come with a playbook. And so nursing homes have done the best that we can throughout this pandemic, and we will continue to do so. And we do so because of the dedication and the commitment of the staff that we have here in our building and other nursing homes have throughout the state of New Hampshire, and truly been heroic throughout this entire process. And they do so, that heroism is there, and the dedication and commitment is there because of the residents that we care for each day. So with that, I'll close my comments and be happy to answer any questions that you might have.
Mr. Labor, thank you so much. That was incredibly insightful and detailed, and just very, very grateful for the work that you do every day, and the staff and residents that you are so dedicated to, and that really comes across in your testimony. My fellow committee members, are there any questions? Representative Birch.
Thank you, Mr. Chair. And thank you, Mr. Labor, for the work you do and the work your staff does. In our communities, you're heroes, and we just want to make sure you and your staff hear that from the rest of us. We appreciate that you're frontline workers and the work that you do. I'm interested in specifically your thoughts about the isolation of our residents, specifically whether you think there are any changes that should be made in the protocols and how much flexibility you may have as an administrator in dealing with those protocols. Specifically, if we're testing staff as they come in with temperature checks and questions and the like, and then they have a reasonable amount of interaction with the residents, including close physical contact, because that's part of their job, why can't activities people come in and interact on the same basis? And what are the restrictions should be for loved ones coming in to those indoor visits? We heard Mr. Brandon Williams say that loved ones can physically touch the resident in those individual small rooms for an indoor visit. But I checked with our nursing home and they say, no, not at all. It's still a 6-foot distance in those rooms and masks and everything else. So can you give us a sense of where you come out on whether there's a possibility for increasing or decreasing social isolation of our residents consistent with safety?
I think that we would approach it the same way. I think that you're the nursing home that you reached out to, Representative. We try to adhere to the recommendations as best as possible. I think that we do, try to look for some gray areas from time to time. But I think the trouble is the trouble is, I think, is if you veer away from any sort of established recommendation, the potential of having the virus introduced and the ramifications that comes with, I think the potential anyway ramifications can be devastating in a nursing home, as we've seen with outbreaks that have happened. It's one of those things. I think that I'm not answering your question very well, and I apologize, but for me, I think that when you look at the social isolation that's taking place, you know, is there an opportunity to, you know, bring that distance closer together, you know, down the road? There's the potential, as we have these testing units in our building, there is the potential that we could use them to test, you know, family members and find out exactly, you know, whether they're carrying the virus or not, and whether asymptomatically. But that runs against what the recommended use of these testing units is, and it's specifically for symptomatic purposes only. And so there's really no kind of sure way to lessen the restrictions that are in place to improve the isolation that residents are feeling without jeopardizing the overall safety of your building, the overall safety of your residents and your staff. And I know that our staff, as I said, they're continuously fearful of everything that's going on. And so when we do, you know, I'll use an example. We had, when we first began our visits, we had one family member, despite the education that we provided, we had one family member who, upon seeing his spouse, went in and gave her a kiss. He was wearing a mask, but he went in and gave her a kiss. And that really upset our staff. And because of the fact that you just don't know, and there's still a lot to learn about this virus. And you know, I think that state epidemiologists would tell you that, and researchers would tell you that they continue to learn about this virus each day. And so I don't think there's really a kind of happy medium, if you will, or an easy way to look to lessen social isolation without potentially introducing the virus or jeopardizing the overall safety of your building.
Can I just do a quick follow-up?
Sure.
And there are two specific proposals that I understand are coming down the pike. One is that the residents will no longer be tested, but staff will, under the theory that the residents won't become infected if the staff are okay. And secondly, the cost shifting for testing would be shifted from the state to the nursing homes themselves. Do you have any thoughts about either or both of these?
I think that the resident on the resident testing portion of it, you know, I think that the theory behind the change is you know, certainly it's understandable because it's true at this point, and it's been like that, you know, quite frankly, going out from you know, basically the end of March, that since we hadn't allowed visitors in our building, so 2 weeks prior, so mid-month of March through the end of March, if the virus ended up in your building, it was due to a staff member bringing it in. So I think the position which the Department of Health and Human Services has taken is accurate from that standpoint. You know, but that being said, I think that you know, asymptomatic transmission is certainly there, and a staff member on a week where we're only testing maybe 10% of our staff, you know, we will perhaps we'll miss somebody, but that doesn't mean that, you know, a resident might not begin to show signs as well. And so I do think that there should be a place for resident testing as we continue, and just to you know, create that sense of security through the remaining months of this pandemic. On the testing aspect itself, yes, there is going to be a change in how the program is administered, and nursing homes, I believe, are going to be reimbursed $100 per test. I know that certain instances, as we've been encouraged to go out and find labs that are willing to contract with us, I know that, you know, I've heard ranges of $100 to upwards of $150, I believe, on what a lab would be charging to process a COVID-19 test. So there is the potential for some additional cost that's going to be assumed by a nursing home. But I've also heard instances on the flip side of that. Some labs are only charging, between maybe say $75 and $85 or $90 a test. So I think, there's variation there, and if the nursing homes will go out and look based on what we know for service availability in our areas, and see what we can do to find the best deal and limit the potential of cost shifting.
Thank you.
Further questions from the committee? Senator Ward?
Obviously, the isolation of the people in nursing home is a huge issue, but how many of them have dementia? Because from my experience, dealing with people with dementia is so much harder than dealing with somebody who has normal faculties. So what is the percentage of people with dementia that you have in your nursing home?
We have roughly 80% of our residents that have that diagnosis.
Wow, that's got to be tough.
Yeah. I think, as I mentioned in my comments, that is the #1 reason for a referral that we receive for admission to our nursing home. It's due to dementia care. Families that have been trying to care for their loved one in the home setting and just can't do it any longer.
Right.
Or because of an accident that has taken place and resulted in an injury in the home setting and resulting in a hospital admission, and that's where the referral comes in after that.
Thank you.
Representative Stringer?
Mr. Labor, thanks for joining us and for the great job you're doing for the Grafton County community, and really appreciate it. You mentioned you're short about 26 people right now. I think you said 14 LNAs and 12 RPNs or LPNs. What's roughly a full complement for you?
I'd say on average, I think we're about 72 LNAs, 72 LNA FTEs. The RNs and LPNs combined were upwards of about 28, 29, give or take a tenth or two.
So you're short about 25%, plus or minus a few. 26 out of 100, I guess, which is similar to what else we've been hearing. We heard recommendations or suggestions that we should encourage volunteerism to a greater degree in nursing homes, obviously taking into account safety precautions that would be needed for COVID. Would that be something that would be helpful to your facility, and could it play a role in reducing staffing shortages? Maybe not in the next 3 months, but say as we come out of COVID.
I think it would depend on the specific volunteer assignment that you're asking somebody to do. I think at Grafton County Nursing Home, we have a pretty active volunteer program. Unfortunately, we haven't been able to utilize it since March. But we have been talking about bringing some volunteers that feel comfortable back into to help out with our visitation program, for instance. But I think, personally speaking, from the standpoint of Grafton County Nursing Home, our volunteers that we have are, they're older in age. They, in some instances, are former spouses of residents. So a loved one may have passed away. And so again, as I was talking about that sense of family, that family members have being here in the building, many times a husband or wife, in some instances, daughter or son will offer to volunteer and help out when they can with our activities programming and things. And so I I think that, what we've seen is volunteerism slowly declining. As I said, they're older in age, and so we haven't seen many people want to, younger generations anyway, be interested in volunteerism here in nursing homes. And so, to answer your question, I think yes, but it would be dependent upon the type of assignment that I think you'd be asking an individual to do and their comfort in doing that.
A couple of questions on testing for you. What would the impact be if the instantaneous test you had was as specific and sensitive, or let's say as accurate as what you're getting from a swab test? And what do you expect to be paying for the instant tests going forward, compared to the $75 to $150 for sending out swab samples?
So the cost, I think, is we haven't really had a chance to kind of sit down and specifically quantify that, but just using an example. So if you're testing a resident and utilizing the Veritor, that's the testing unit that we received, and that's the one that I mentioned in my comments about having an 84% accuracy, and therefore requiring the nasal swab follow-up to confirm it's actually negative. Using that machine still results in having to put a resident on isolation, and so therefore utilizing full droplet precautions for that resident until the test result comes back. And so then you start to use your personal protective equipment, using gowns each time you go into care for the resident, using your masks, using gloves, using protective eyewear. So to specifically sit down and give you an exact dollar figure of what that cost would be until, over the course of 48 hours, on average anyway, of how long it would take to get the result back from a lab on the nasal swab. I can't give you that dollar figure right at this moment, but certainly something I could follow up in an email with you if you'd like.
I was actually interested in just the instantaneous test part of it, not the swab part of it. So, and I was asking if it was accurate, and you didn't have to then do the swab test. Trying to understand how much leverage you might have to do substantially more testing as these additional, much more accurate instant tests come available.
I think that the potential of us, there's been discussion of us receiving another testing unit from the federal government. It's called a Binax Now, essentially a little card that has a 97.4% accuracy rate, I believe. In being able to utilize that in place of the Veritor would be hugely impactful, because you get, is my understanding, within 25 to maybe 35 minutes, you get the result. So you have a resident displaying signs that are concerning enough that warrant the test, administering that test and knowing within a half an hour of whether it's positive or negative, that would be huge.
Okay, back to you.
All right. Great. Thank you, Mr. LaBoer. I just had a couple of questions for you. Is there anything, you mentioned I guess that one of the big things that really concerns me from your testimony is the discussion around the PPE supply, especially heading into the colder months that we're obviously transitioning into. Is there any light at the end of the tunnel? Is there anything that the state can be doing more aggressively? I know that you mentioned Commissioner Shivanet has been incredibly helpful, and I'm so grateful for that. But is there anything more that we can be doing in terms of recommendations you might have?
I honestly think the department has done all that they can. I think that they're facing the same challenges that we are in regards to trying to secure PPE. And it's really more of a nationwide issue. I know in the beginning, in the springtime, the state, I think through the assistance of Dean Kamen, were able to secure several large shipments of surgical masks. And upon doing that, the state of New Hampshire gave nursing homes a tremendous amount of supply that we still currently have in place. So they've been very, very supportive. And I think any challenges in regards to PPE that we are seeing now or are going to continue to see are really going to be out of the control of the state as well. Because I know that I feel very confident in saying that if it was within their control to be able to secure items such as medical gloves or disinfecting wipes is another thing that we're starting to see shortages on. If they were able to secure those, they would certainly be doing it and you know, allowing the nursing homes in the state to be able to access them.
It just blows my mind that we've been doing this for the better part of a year and we can't get gloves or disinfectant wipes for our nursing homes. We've heard previous testimony regarding resistance from staff members about being tested. What, you know, not a majority, but a minority of staff members still being resistant to being tested. Have you experienced any of that up in Grafton County?
We have had some staff that have been resistant. I think, again, with it being fear in regards to, you know, as the staff would say, the invasive swabbing using the nasopharyngeal swab. As we've been doing our sentinel surveillance testing program, the interior nares swab that doesn't go in as deep into the nasal cavity, you know, staff have been certainly more receptive to that method of testing. But I think, you know, in certain instances as well, it's been a lack of education for staff. And so that's something that we've tried to do differently. And what I mean by that specifically is that, you know, they've participated in one testing event and they came back negative. So there's no need to test again because they already know they're negative. You know, and so we've had to talk about how the virus can take anywhere from 2 to 14 days before you start to show symptoms of having it. And so that's why participating in the sentinel surveillance testing program is so important for the protection of you and your family and ultimately, most importantly, the residents that we have here living with us.
Thank you. So, and I'm really grateful for your recommendations to the committee regarding the continuance of long-term care stabilization fund, particularly as we move into fall and winter and anticipate an unfortunate uptick in virus transmission and positives within the nursing home. I know that I will be 100% supportive of those efforts and I will do everything I can personally to make it known that that's an important ask. But you know, we'll also as a committee have a discussion about that, and I'm cautiously optimistic that we'll put that on one of our final recommendations. Senator Ward, what do you think? Can we spearhead a nurse training bill with CCSNH, with the Community College System of New Hampshire? Should the people of our district?
Yeah, my understanding is that a lot of the community colleges already have a lot of LPN programs in place, and even the associate nurse, you know, 2-degree nurse program. So I'm surprised that we haven't got any of those numbers yet, because I know that the Monadnock Health Group has been discussing this for, I would say, 2 years anyhow, to look into what college has the program, how many do they get in, how many graduate, and where are they going, in an effort to help out all the agencies and all the facilities that need this kind of professional.
Yeah, so so Mr. Labor, I think what we'll do is we'll talk with the new chancellor and see where those programs stand, and if there's more that we can do. I know that, you know, the nursing shortage in the state of New Hampshire and far beyond is not simply a COVID related thing or issue, but it's certainly exacerbated by the situation that we're in. So you know, we'll dive into that a little bit and see where things stand. Representative Birch.
Yeah, you may want to check with Catherine Kindop, who's the administrator of Maplewood Nursing Home, our county nursing home in our area, because there's been a lot of effort towards trying to get local community college and the like to turn out more LPNs and nurses. And there are incentives through our county nursing home to do that and then work at the nursing home in terms of tuition payments and the like. So there is information out there that you or the staff can collect.
Ken, did you get that name down?
Yes. Also, Senator Ward, Kathy Gray from the Monadnock Healthcare Group is on the tentative agenda for next week.
Oh, okay, good.
Awesome. Thanks, Ken. Mr. Labor, thanks so much. Any further questions from the committee before we let him go? Thank you very much, sir, and we look forward to interacting with you as we finalize this report this month.
Thank you very much for the opportunity.
All right, so for members of the public who are still with us and can hear us here, Representative Birch, you had a couple of suggestions for folks to join us for future meetings of this committee. I believe we have, Cam, we have Mr. Tom Blonsky from Catholic Charities, who's going to join us and give us a short presentation on the 15th. Is that what you said? Or the 8th?
Tom Blonsky is on for the 8th.
The 8th. Perfect. Representative Birch, you had a couple of ideas that we discussed beforehand. I just think it would be good to get those on the record.
Sure. I had suggested Susan Buxton, who is New Hampshire's long-term care ombudsman, speaks for on behalf of the long-term care residents, and perhaps someone from the State Commission on Aging could provide useful information.
Great, thank you, Representative. Give me 1 second here. All right. If we could, is there any other business to discuss from the committee members? All right. Seeing none. Oh, sorry, Representative.
Minutes. Do we approve the last minutes or not?
Oh, I don't think we did.
We have not yet.
Well, let's do thank you very much, Representative. Let's do a roll call vote here on the minutes from September 24th. Senator Ward?
Yes. I approve them.
Representative Stringham?
Yes.
Representative Birch?
Yes.
Representative McMahon, I believe you were not here. Yeah.
Right, so I'll abstain.
Great. And Senator Morgan's a yes. And then if there's nothing else from the committee, can we open it up for public comment, please?
Yes, if anybody in the public would like to weigh in, you can raise your hand, or if you're on the phone, you can press *9 to raise your hand.
All right, well, seeing none, thank you all very much for joining us. We will reconvene on the 8th at 10 a.m. Via this platform, and we'll see you all back here then.
You have
Thank you
to
all.
take it. You have to
Oh,
take a
yeah.
vote
Motion to
adjourn.
dis- I make a-
Representative Stringham moves, Representative Birch seconds. Senator Ward, how do you vote on adjournment?
Positive. Yes.
Representative Stringham,
my 97.4% positive.
did you get that down, Cam? I want that in the minutes. Representative Birch,
Yes.
Representative McMahon,
Yes.
and Senator Morgan's a yes. Thank you, everyone.
Thank you.
Thank you.
Thank you very much.